Welcome to our second segment of In One Breath, a weekly series during the month of November to bring you information about lung cancer and the American Cancer Society's mission. I am Mayela Allen, Executive Director at Your American Cancer Society. During our last week's segment, we discussed the importance of lung cancer screening and addressed safety concerns during a pandemic. For today's conversation, we're discussing lung cancer and its impact in our community. Joining us today is Dr. Abubakr Chaudhry, a pulmonologist at the Pulmonary and Critical Care of Atlanta, a Northside Network Provider. Welcome, Dr. Chaudhry.
Well,
Thank you
thank,
for joining us today.
well, thank you for having me. I appreciate it.
Wonderful. For our first question, let's start from the basics. What is lung cancer?
So it's a great question, and I want to take it a step back and kind of talk about the body's kind of normal physiology first. So the body has a phenomenal mechanism of maintaining growth and proliferation throughout its life cycle through cells and regeneration. Now, we do a good job genetically with if a cell is growing abnormally, we can stop it and get rid of that cell and let the normal cells grow.
Mm-hmm.
In cancer, cells that grow abnormally and are not stopped, they proliferate and keep going. And these abnormal cells then take a life of their own, and we call them malignant or cells or cancer cells.
Mm-hmm.
Now, depending on the area that they're involved in, that's where we give them the name as either lung cancer because they're cells within the lung or another organ system.
Thank you. What are the symptoms?
So great question. And the hard part is that most early lung cancer are asymptomatic. So that's why screening is so important, especially in the case of being a smoker.
Mm-hmm.
But the most common symptoms, if you look at the data for patients who do have symptoms, is cough. Now, I don't want you to get scared and Google, like, if I have a cough, do I have lung cancer? That's just the symptom
Right.
that it presents with. The ones that we get more concerned about are coughing up blood or unintentional weight loss. Those are the two things that we get a little bit more concerned about.
Mm-hmm.
A cough by itself is just a symptom for a lot of things, but that is something that's very common in lung cancer.
Okay. Could you share with us maybe what some of the risk factors are?
Of course. As most of you will probably know, the most common risk factor is smoking. 80% of patients who get lung cancer have smoked, but among the risk factors, that's not all patients. A lot of people who get lung cancer have never smoked. And those are individuals that have, either genetic abnormalities, they've been exposed to radon, which is actually the second most common cause of lung cancer. And, if you've ever purchased a house or gone through that, they always ask, well, do you want us to check for radon? And that's something that we do recommend as well, because exposure over time increases the risk. And then the fourth part actually is the secondhand smoke factor as well.
Mm-hmm. So could you share with me who typically would get lung cancer?
Right. So anybody can get lung cancer. And I would divide this as, if you look at the causality of it,
Mm-hmm.
and then look at the risk factors, like the reasons why people get it, and then look at the age. The longer you smoke, the more kind of insult you have in your lung, so the higher probability of lung cancer is at an older age. Now, if it's a genetic abnormality, it can happen at any age.
Mm.
If it's radon exposure, it could happen during the time of exposure. If it's secondhand smoke, it can happen during that time. So it's very important to know what the risk factor is, depending on the variable, and comparing that to who gets it at that time. Most cancers present after the age of 40, and those will be equivocal in men and women now. Before, men were at higher risk, but now the demographic for women has kind of inched up, and now they're more equivocal in that way for risk.
Thank you. From your perspective as a pulmonologist, what has been the impact of lung cancer in our Georgia community?
That's a great question. Now, if we try to rank, depending on what the statistics are available, and we're around 32 out of 50 continental U.S. of the incidence of lung cancer. So we're pretty high when it comes to comparative statistics.
Mm-hmm.
But I think the more important statistic to focus on is how many lung cancers are caught early. and only 18% of lung cancers are caught early in Georgia. That's why I think it's very important um, to get screening if you meet the criteria for screening. And I know that you've had this lecture before, or with another physician in regards to lung cancer screening. Maybe
Mhm.
if you're over the age of 55 or between 55 or 74, and you've had a significant smoking history, talk to your pulmonologist, talk to your primary care provider to see if you meet that criteria for lung cancer screening.
Yes.
Now, the community itself, if we can treat these earlier, then the impact will be less because you'll have more cancer-free
Mhm.
patients.
Thank you. That was some very good advice. Dr. Chaudhry, is lung cancer treatable?
Yeah, yes, I think that's one thing that I'd like to reassure my patients, regardless of the
Mhm.
cause of why they get lung cancer, is that we do have, and we've been blessed recently with the amount of research that's gone into looking at targeted therapies for lung cancer. But I have to preface that the most important thing is to catch it early and to cut it out, if we can, depending on the cell type. So the more that we catch early, the more cancer-free patients that we have. Now, if you do have cancer and you're listening to this because you're dealing with this right now, we do have therapies that are very advanced, they're very targeted, that are oral therapies. Previously, we had to put you in infusion clinics and whatnot. Now we've had more research, and there's medications that are coming out, almost every quarter now, with research that's coming out to help us provide more targeted therapies for these lung cancers.
Yes, most definitely. And that again just stresses the importance of research.
Right.
So, if you could summarize in one breath, Dr. Sharp, what would be your takeaway message for our viewers today?
All right. So I would, uh, I would screen early. Anyone can get lung cancer, but there's a higher risk if you're smoking and if you're older. And to know that we're in this together and we can help you.
That was pretty good in one breath. Thank you so much for summarizing for us.
You're
And
welcome.
we appreciate you joining us today. We also want to thank everyone who joined us. A special thank you to our In One Breath Education Series partner, Northside Hospital. For more information on today's topic, please visit us at www.cancer.org. And join us next week for a special segment as we will be celebrating the Great American Smokeout and highlighting successes in our community. See you then.